Thanks, Tom, and good afternoon. Today, I am pleased to report that 6,811 Albertans have now recovered from the virus, leaving 386 active cases in the province. Currently, 53 people are hospitalized, with 6 of those admitted to ICU. We have now completed more than 325,000 tests. Out of 7,746 tests completed over the past 24 hours, we identified 30 new cases. I am happy to say that no additional deaths have been reported. As we enter stage 2 of the province's relaunch today, I want to talk about what we can expect in the days and weeks to come. First, I want to highlight 2 First Nations success stories that showcase the power of teamwork and community spirit. Since the first COVID-19 case was detected in Alberta, the Blood Tribe Chief and Council have been working diligently to mitigate the impacts of COVID-19 on the Blood Reserve, supported by Alberta Health Services and the First Nations and Inuit Health Branch. Staff in this community have implemented measures like establishing a 35-bed clinical isolation facility for community members who fall ill with COVID-19 or for those who are ill and need a place to isolate while awaiting swabbing results. Another key accomplishment has been delivering 2,540 food and cleaning packages to Blood Tribe members on and off reserve to ensure they received support immediately. Also, the community health and essential services staff in this community are working hard to continue testing, contact tracing, and care for those in quarantine and isolation, and all Blood Tribe administration programs and departments have shown dedication to the well-being of their people. In particular, local leadership asked that Rick Soup, the Disaster and Emergency Manager for the Blood Tribe, be recognized for his support and leadership during these challenging times. In Whitefish Lake First Nation, the community's Goodfish Lake Business Corporation responded to the pandemic by adapting their garment facility to produce reusable masks. This has not only enabled them to provide cotton masks to elders, staff, and every household on reserve, but also allowed them to now fill large orders of fire-resistant masks for Syncrude, Suncor, and other energy companies. These are both great examples of innovation, especially as I continue to encourage everyone to wear masks in crowded settings and to look out for your neighbors. I know that many people are excited that stage 2 has arrived and that many others are wondering what this will mean for our province. Will we see increases in cases and new outbreaks? If so, how do we respond? It is important for all of us to remember that this virus is not gone. COVID-19 is still circulating in our communities and will do so for many months to come. With the increased opportunity for activities and gatherings, there is increased potential for all of us to be exposed to COVID-19. Over the past few weeks province-wide, we have begun to see a younger demographic testing positive for COVID-19. 60% of our currently active cases are under the age of 40, and we are seeing a particular increase in those between 20 and 29. It is important for younger Albertans to remember that while you may not be at risk for severe outcomes of infection, your actions are critical to protecting those around you who are at higher risk. We are all in this together, and we have never needed each other more than now in this relaunch time. Recently, we have also seen a rise in cases in Edmonton. In the past 3 weeks, the number of active cases has risen from 58 to 149. While any increase is concerning, there has been no single source or cause identified. About 2/3 of these cases are linked to known sources or outbreaks, and about 1/3 are not yet linked to a known source. We are watching these cases closely and will communicate to Albertans if there is any cause for alarm. I have been asked if the increase early this week might partially be the result of recent protests in the city. I can tell you that is not the case, as any transmission would take days to work through the system. We have seen a rise in our testing numbers in the past few days as those who attended protests have responded to my recommendation to be tested. But to date, we have not identified cases where attendance at a protest was determined to be the source. Having said that, it is important to stay vigilant. The freedom to protest is a critical one, and preventing the spread of COVID-19 is also critical. We have worked with several of the groups who organized recent demonstrations to put together a guidance document for organizers and attendees with ways for demonstrations, marches, and rallies to accomplish both goals of raising voices and preventing spread. Options include using virtual means, car rallies, and groupings of 100 with distances between the groups. I would like to remind anyone participating in any future demonstrations to stay 2 meters away from one another and to wear a face mask while attending. I also strongly encourage anyone who attends a protest or any other large gathering to download the AB Trace Together app. This will help speed up contact tracing should a case be identified. As we get out and enjoy Stage 2, I want everyone to be proud of how far we have come and to continue following public health guidance in every facet of our lives. We are all protecting each other. I want to end by recognizing that today is not a celebration for everyone. While many are excited to move into Stage 2, I know that some people will continue to feel anxious. It is natural to feel this way. I am also keenly aware that many residents in continuing care centres and their families continue to feel lonely and isolated. I have heard these concerns, and I think about people in these settings often. We are exploring ways to gradually lift some restrictions as the relaunch proceeds, while still maintaining safety at these facilities. We are balancing the duty to protect residents and staff within these sites with the natural need for human connection and social interaction. The other piece I want to speak about today is that I know that many Albertans have been struggling with addiction and mental health issues throughout this pandemic. According to the Canadian Centre on Substance Use and Addiction, 1 in 5 Canadians who drink alcohol and have been staying at home more due to the COVID-19 pandemic say that they have been drinking daily since the beginning of May. The AGLC has reported sharp increases in the sales of wine, beer, and liquor, as well as cannabis, since our public health measures were put in place. I know this has been and continues to be a stressful time. Unfortunately, high-risk use of cannabis and alcohol can cause other health problems. If you are struggling, I want to remind you that confidential support is available. You are not alone. We are working to reduce any barriers that might be in place to access the mental health or addiction supports Albertans need. Alberta's mental health helpline is available 24/7. It is toll-free and offers confidential support for mental health concerns. Alberta's addiction helpline is also toll-free and available 24/7. It also offers confidential support for alcohol, tobacco, drugs, and problem gambling. I encourage anyone in need of help to visit alberta.ca for more information on all the supports that are available. I want to thank everyone for continuing to be mindful of your actions and following public health guidelines. We are getting through this together, and we must continue to protect each other in the days ahead. Thank you, and I will be happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first question, please?
First question is Michael King with Global News. Go ahead, Michael.
Hi there, Dr. Hinshaw. Where are we seeing the highest increase in testing across the province, and where are we at with testing capacity and supplies?
So that is a really good question. I don't have the testing numbers by zone at my fingertips, so that's something we'll have to get back to you on. With respect to testing capacity and supplies, we were anticipating to be able to shift from approximately 7,400 tests a day to close to 10,000 tests a day in this time frame towards the end of June. And with respect to supplies, we are monitoring closely. We, at the moment, have sufficient supplies to be able to maintain our current rate of testing at around, again, 7,400 tests a day, moving again into that slightly higher capacity within the coming days. But we do continue to monitor because sometimes there are unexpected incidents, such as we have in the past received a shipment of swabs that's unfortunately been contaminated. So while at the moment our capacity and supplies are adequate, we always have to watch that and make sure that we're maintaining ongoing supply chains and making sure that we're getting those supplies in a timely way.
Operator, can you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. I'm hoping to get a quick update on the outbreak at Alberta Hospital. I understand the number of cases there now is 7. AHS has screening for staff, and there are supposed to be precautions in place. So how does this outbreak happen, and what, if any, gaps have been identified? Also, you have said in the past that restrictions could be brought back into certain communities if the case numbers require it. I'm curious what that would look like and how it would work, and do you expect that it will be difficult now that people have some of their freedoms back?
So with respect to Alberta Hospital Edmonton, you're correct that there are now 7 cases. There are no patients who have been affected. So that is 7 cases in staff. I don't have the most recent information with respect to local public health investigation. So with respect to lessons learned or where the gaps have been identified, that's something that, again, local public health would have those details, but I haven't been provided with those. With respect to where we would make a decision or when we might make a decision that additional public health measures might be required, so the metric that's been put in place is the 50 active cases per 100,000 in a particular municipality. And so there is a map on our webpage that does showcase the municipalities across the province and where there may be a municipality or a municipal district that's gone above that. In municipal districts with small populations, there's a minimum number of 10 active cases that needs to be met before they would cross over into that threshold. And as I mentioned on Wednesday, it's not surprising that we would see, especially with smaller population municipalities or municipal districts, that some of those municipalities may be crossing back and forth into that 50 active cases with a minimum of 10. And what that means is it gives us an opportunity to have a conversation with local administration in the municipalities that are impacted to understand more about their local context, whether there are any additional measures that need to be put in place, and then in conversation with municipalities, again, coming up with where we think the cases are coming from, what, if any, additional measures would need to be put in place, and then working again to implement those things locally. And to date, we, again, have not, from a provincial perspective, felt that there's any imposition of additional measures that are needed. And we look forward to the opportunity to have those local conversations if we should be seeing increased case rates in different municipalities.
Operator, can you put through the next question, please?
Next is Kevin Nimick with CTV Calgary. Go ahead, Kevin.
Hi, Dr. Hinshaw. Today, Prime Minister Justin Trudeau announced temperature checks will become mandatory for airline travel in Canada. Previously, Dr. Tam said those tests were ineffective. So where do you stand on temperature tests, and could they become mandatory for accessing services like schools in Alberta?
So with respect to checking temperatures, we know that not everyone who has COVID-19 has a fever as a part of their illness. And so as a standalone measure, if that were the only measure that were being put in place, that wouldn't be sufficient to catch all people who might be ill. So with respect to using that as an adjunct to multiple other measures, as you know, that's something that has been put in place in Alberta for returning international travelers. And it is something that is a part of a multi-step process. So again, as a standalone measure, it would not be considered to be effective. It does need to be partnered with multiple other interventions and screening tools. And so I think as the evidence continues to emerge, we'll be watching closely to see whether or not using a temperature check would be something that would be helpful in other settings. At the moment, it really is focused on that international travel setting, and it's not at the moment used in any other settings in this province. And again, we'll continue to watch evidence and determine whether or not it could be a useful adjunct to include with other measures that are in place.
Operator, can you put through our next question, please?
Next is Laurent Perreault with Radio Canada. Go ahead, Laurent.
Hello, I was wondering whether you could point to some things younger people do that might trigger those increases that you talked earlier. Can you describe those?
So what we're seeing in the cases that have been investigated over the last week to 10 days is that people are, I think, feeling encouraged by the restrictions being lifted and perhaps maybe going above and beyond what was intended by the restrictions being lifted. So we're seeing social gatherings, we're seeing parties and celebrations where people are coming together, sharing food and drink, enjoying each other's company after having been apart for a long time. And again, I want to emphasize that it is completely natural that we all would want to enjoy social interaction after a time of having been apart. But the important thing to remember is that COVID has not gone, and it will not be gone for some time. So the common pattern, again, seems to be more socialization, getting together in groups and sharing food and drink, and not maintaining that 2 meters of distance. And also, I think the other reminder is that when someone is feeling ill, that they should stay home, they should not go to a party, they should not have a party, because really when people are feeling ill, again, that's where there is a higher likelihood that they may spread infection. Having said that, I again want to say how deeply, deeply grateful I am that those who are feeling ill are going to be tested, because the last thing that we would want is for those who feel ill to be out and about, to be interacting with people, but then feel ashamed and not get tested, because then we would not have the opportunity to stop those chains of transmission. So again, I want to remind people, if you are feeling sick, please stay home and get tested and make sure that we can then work together to stop the spread.
Operator, can you put through the next question, please?
Next is Lisa Johnson with Post Media. Go ahead, Lisa.
Good afternoon, Dr. Hinshaw. I'm wondering, with pools and indoor recreational facilities allowed to open up today, if you can explain why it might be safe for people to go into pools, especially with some of the things people sometimes do in pools, and how is physical distancing recommended in those situations?
So we do have specific guidance for swimming pools, and any pool that's opening must have a responsible person who can ensure that the COVID guidance is being followed. So certain things such as lane swimming, there's measures that can be taken, for example, potentially increasing the width of lanes to make sure that people can stay 2 meters apart from everyone else at all times. Potentially having one-way lane swim, so potentially going down one direction and then going into an adjacent lane to go back. Again, those are just some specific examples. We are permitting recreational swimming for families, but the expectation is that families would be staying at least 2 meters apart from other household members. So one household would be 2 meters apart from another household, to be clear. And so really there's part of that is the responsibility of operators to have reminders for those who are participating in events. And part of that is the responsibility of all of us to make sure that we are continually monitoring our own actions and behaviors, staying 2 meters apart from others at all times. And if anyone is feeling ill, they should not be in one of those facilities, whether they're a staff member or a member of the public who's wanting to access those services.
All right, there's only one more in the queue, so operator, could you put through the final question, please?
Final question is Jason Herring with the Calgary Herald. Go ahead, Jason.
Hi there, Dr. Hinshaw. I've got two quick ones. The first is one of the numbers that jumped out to me today was hospitalizations. I see that we have 10 more hospitalizations than yesterday, if I heard correctly, wondering if there's a reason for that. The other is that I noticed that on the data hub online, there's now data about comorbidities. I'm wondering if you can chat a little bit about what the comorbidity data is telling you.
Sure. So we have seen an increase in the number of hospitalizations at this point, and you may recall that maybe a week or 10 days ago, I can't quite remember, we had a similar thing happen where we were at around kind of 40-ish, and then we went up to 55 hospitalizations. That came down again, and now we're back up to 53. So over the course of the last few weeks, that number has remained relatively constant with some daily fluctuations. I don't have the details of the individuals who've been hospitalized in the last day or so, but what I know is, of course, that those who get infected with COVID, people who do have chronic conditions or who are older, are at higher risk of having a more severe course of COVID. And so it does depend on who ends up being exposed to and infected with COVID as to where those hospitalization rates will sit. With respect to the comorbidity data that's online, what we're wanting to show Albertans is that those who have no complicating factors, no chronic conditions, that they are at lower risk for severe outcomes, and those who have more chronic conditions are at higher risk. But what's also really interesting in that data, if you see what's been posted online, is that the ICU admissions, 1/3 of those ICU admissions are in people who have no chronic or predisposing medical conditions. So while it's a very small proportion of those who pass away who have no known medical conditions, it is possible that those otherwise healthy individuals can end up in hospital or in ICU. So again, I think the purpose of that data is really to demonstrate that the more chronic conditions an individual has, the higher risk they are for having a severe outcome. But it is also a reminder that no one is guaranteed to have a perfectly risk-free course if they do get infected with COVID-19. So there's sort of two main messages in that data.
All right, thank you all for joining us. Dr. Hinshaw will provide another update on Monday afternoon. Have a safe weekend.